everybody, this is Dr. Matt Weed, pediatric ophthalmologist with the Spokane Eye Clinic. Today in this video I'm going to answer 3 questions that I frequently get from parents regarding their children's eyeglasses. The first one is some variation of this statement. I picked up my child's glasses and I looked through them and I couldn't see anything. Are you sure this prescription is correct? I think it's too strong. I often respond to this by pointing out that the reason they can't see through their children's glasses is because they weren't made for them, they were made for their child. Just like if their child tried to put on their parents' shoes and run through the house, this wouldn't work very well. So when you try to put on your son or daughter's eyeglasses, it probably won't work very well for you either, because those glasses weren't made for you, they were made for your son or daughter. Your eyeglasses prescription is based entirely on the size and shape of your eye and the structures within it. And just like your shoe size is based entirely on the size of your feet, so it is with your eyeglasses prescription. It's a very individualized thing. So don't worry if you look through your children's glasses and can't see anything at all. That doesn't necessarily mean anything's wrong. Second question is, sometimes parents will say, I noticed that this year the prescription has gone up. Is that a bad thing? And the answer is no, not necessarily at all. As long as your child is able to see everything that they need to see on the eye chart with each eye, I'm happy. Just because the prescription gets bigger or smaller one year, even though that is a change, we don't view that as a positive or a negative thing at all. The final question that I'll frequently get, especially from a child who's receiving their first prescription for glasses from the parents, is, will they always need to wear glasses? And I understand that question. That makes sense to me. The answer is, I don't know for sure. Every child's a little bit different. And like we mentioned earlier, the prescription is based just on the size and shape of your eye. As a child grows, their eye grows too, and it may grow in a way that makes their prescription get smaller. They may even not need to wear glasses in the future, but it may also grow in a way that causes the prescription to increase and keeps them in glasses for a time, and it's difficult to predict this. One good rule of thumb, however, is for a child who is far-sighted, the prescription will typically increase up until the age of about 7 years and then taper off after that on average. And so if I have a child who's already wearing glasses for farsightedness at age 2 or 3 years old, I often tell parents, I expect your son or daughter to continue to need to wear glasses for at least the next several years. But as I said earlier, that's just a rule of thumb and every child's different. Of course, if you have any questions about your child's vision or their glasses prescription or anything else regarding their eyes, here at the Spokane Eye Clinic, we're happy to do an evaluation and answer any questions that you might have. That's all. Thanks for watching.